The next method of breast reconstruction that we'll talk about is autologous tissue reconstruction, or reconstruction utilizing your own tissue. So there are many different ways to do this, many of which are done in very specialized centers. So if you want to use your thigh tissue or buttock tissue, for example, to reconstruct the breast, then this is best done typically at a large tertiary care facility or with physicians who do this procedure regularly. There is a much more common procedure done called the Tram or DIEP Flap that will help to restore your breast tissue utilizing your own abdomen with a tissue that we typically would throw away with a tummy tuck. So as you can see here, this is the lower abdominal tissue that we would typically remove with a tummy tuck. This tissue is supplied with blood from the rectus abdominis muscle, which is your six-pack muscles that run down the center of your abdomen. We can utilize either that entire muscle or part of that muscle or none of that muscle and its blood supply with the overlying skin to reconstruct the breast. This is still a much more in-depth procedure than expander and implant-based reconstruction. It involves the use of an operating microscope and an actual tissue transplant to transplant this tissue from your abdomen to the chest. We'll need to remove a very small part of your rib and dissect out blood vessels in your chest to hook up those blood vessels to from your abdomen. But in general, this will give you a much more natural appearing breast, which means that your breast will be, instead of sitting up higher like an implant-based reconstruction, it will sit a little bit lower and be a little bit more droopy than an implant, more like your natural breast. This is an excellent procedure for anyone who wishes to not have any surgery on their contralateral breasts, so they want a breast reconstruction that looks a little bit more natural. Women who have much larger breasts can also typically achieve a good reconstruction with an autologous reconstruction because it will more closely resemble their natural breast. Or women who've had problems with either radiation, infection, or other problems with their original expander-based reconstruction are also typically candidates for an abdominally based autologous reconstruction. Again, there are many different ways to do an abdominally based autologous reconstruction, and you want to go with the way that your surgeon feels most comfortable with. The Tram Flap is the transverse rectus abdominis myocutaneous, can be done either pedicled, where we keep it attached to you, or where we remove some of the muscle. The DIEP Flap, or the deep inferior epigastric perforator flap, is where we actually split the muscle, remove only the artery, and we keep all the muscle and fascia intact. While there are various studies showing the superiority over one way or another, it's just important that you pursue the method in which your treating surgeon and you are the most comfortable. Dr. Park and I typically try to perform a deep inferior epigastric perforator flap and spare the muscle and fascia when it's appropriate. Your surgeon may choose to order a CT scan of your abdomen to look for these arteries prior to surgery, which again is what Dr. Park and I will typically do. If this is the type of surgery that you wish to pursue, it's important that you talk in depth to your surgeon about this, as there are lots of different ways to do this, but you want to make sure that you're doing what you and your surgeon are most comfortable with.